A very good day to the moderator and all participants. The topic of our presentation is the pandemic and its effect on Malaysian women, emotional distress, stresses, and socio-demographic. The pandemic COVID-19 has drastically changed lives. The year 2020 is marked as the challenging year not only for Malaysia, but for the entire world, for no nation has seen the current circumstances. It has caused a massive spike in anxiety levels across the globe as China locked a lot of districts and Italy followed a similar pattern due to the high rates of infection. Quarantine and isolation seem to be the prevention method that the world is currently following. The invisible enemy has caused a great deal of fear amongst people worldwide, whereby social distancing and isolation are practiced, avoiding close contact with a potential COVID-19 carrier. The disruptive effects of COVID-19 has dominated lives of many, resulting in anxiety and fears that should be acknowledged and not ignored, and Malaysia is not exempted. The government announced the movement control order as a measure to slow down the spread of COVID-19. Working, learning, and shopping have all been switched online. Except for employees working in essential industries, people were being ordered to stay at home and should not stay outside without any valid reasons. Studies have indicated that similar pandemics increased the prevalence of below symptoms during and after a quarantine or isolation period. Post-traumatic stress disorder, or PTSD, specifically associated with COVID-19, includes the traumatic experiences of oneself or loved ones being infected in general population, our frontliners witnessing the suffering and death among their patients, constantly being exposed to the threats of infections at work and the worry of bringing it back to their family members, also the constant and high exposure to COVID-19 related aversive news. Confusion. This may occur among the community with regard to the purpose, methods, and standard operating procedures of quarantine due to the inadequate information or guidelines being disseminated. A perception of lack of transparency from the health and government officials and unsure about what is appropriate or safe and what is not due to the lack of knowledge. The feeling of loneliness. This is due to some who are staying alone, the elderly, or some who may not have close friends or perceived low social support and due to unfulfilled social needs due to the MCO. The anger are resulted due to the frustration and boredom in quarantine or during quarantine as freedom to move around are restricted and social activities are not permitted. Plans such as gathering, wedding, parties were forced to cancel. Change in plans such as graduation, employment. This may result to the communities being angry. On top of the challenges mentioned above, domestic abuse and violence also affects women's mental health. This is due to the increased conflicts as families are staying together for a longer period of time. It was also found that financial difficulties and unemployment increases the risk of abuse. A 24-hour Talian Kasih or telehealth platform is provided by the Ministry of Women, Community and Development in the joint effort with the Board of Councillors, and it is still operating until today. There was a 57% increase in calls requesting for assistance and counselling since the start of the movement control order. Some of the issues handled via the hotline were on financial constraints, marital problems, and domestic violence. Calls for assistance are handled by respective district welfare officers who then channel calls to registered counsellors for further actions. The lockdown has severely impacted the people. People are forced to stay at home during the lockdown and their daily routines are disrupted. Moreover, they also face other challenges such as lack of social interactions, fear of being infected, stress, and financial difficulties. On women's emotional well-being, it was reported that single women below the age of 25 are vulnerable to depression and anxiety, especially when their family and friends are being diagnosed with COVID-19. Thus, there is a need to investigate the emotional well-being of the population in order to better address the challenges they are facing. Since the emotional distress varies across populations with different cultures and living conditions, the past studies cannot be generalized to the population. There are three objectives in the current study. First, the study wishes to examine the impacts on women's emotional well-being due to the COVID-19 lockdown. The sample uses Malaysian women aged 24 years old and above as target samples. The second objective is to examine the prevalence of emotional distress among women due to COVID-19 lockdown. Last but not least, the study aims to identify the stressors predicting women's emotional well-being. The study is guided by the emotional stressor framework. It illustrates the relationship between the stresses and emotional distress. The stresses include financial issues, marital issues, poor living conditions, poor adjustment to working from home, stress being a frontliner, and other personal issues. These stresses mentioned can lead to emotional distress if not managed properly. Past literature review were looked into to guide the researchers with the required information. Then, a survey method was employed, which includes three parts. Part A focused on the demographic information, while Part B and C focused on the emotional distress and emotional stresses, respectively. Data collection was conducted using Google Form links that were shared by the researchers through their social media platforms and networks, and the sample were women above 24 years old. 1,793 valid responses were received. Data analysis were then conducted using the exploratory factor analysis. The Depression, Anxiety and Stress Scale, or better known as DAS-21, were used or adopted to measure the level of depression and stress among participants. The screening and outcome measured reflects the women's emotion based on the past 7 days. For the purpose of this study, only depression and stress are measured with 7 items for each scale. Depression refers to low levels of positive affect that includes dysphoria, hopelessness, lack of energy, and anhedonia. Stress refers to the physical, mental, or emotional tension that occurs in response to immediate environmental factors interpreted as threats. The table below shows the demographic information of the total of 1,793 participants. Age group is above 24 years old. The household income were recorded between Malaysian ringgit 3,000 to 10,000. Job status, where most of these women worked from home. Education level recorded that most of these women have done their tertiary and postgraduate studies. And household size is in between 2 to 4 members. And most participants are married, and living conditions has indicated that 85.9% stayed with their family. Among the 1,793 participants, 669 participants were categorized as emotionally distressed, and the stress level is significantly higher than the depression level among all the participants. Among all the predictors, only age and total household income were found to be significant predictors of emotional distress. This indicates that younger women and those with small household income tend to experience more emotional distress. The significant socio-demographic predictors are age and income levels. We identified 5 significant emotional stresses, namely marital issues, financial issues, living condition, emotion, and working from home. Marital issue. The items used to measure the marital issue as a stressor specifically relates to the poor relationship with husbands or partners in accordance with reports provided by the Ministry of Women, Family and Community Development and Women's Aid Organization, both of which reported a spike in hotline calls made by women relating cases of domestic abuse and other marital issues ever since the lockdown was imposed. The elevation in domestic violence were due to lack of respect and appreciation from the spouses who use these women as a punching bag. Even in harmonious marriage, the MCO has witnessed a disequilibrium of responsibilities which are mainly placed entirely on the women. Therefore, continuous support from the government may help empower women in finding ways to cope with the distress. The emergence of financial issues as one of the significant emotional stressors was somewhat expected due to unemployment, income loss, and lack of non-existent emergency funds. According to the Department of Statistics Malaysia, the nationwide lockdown resulted in an increase of 5% in an unemployment rate, the highest since 1990, and approximately 71.4% out of 168,000 self-employed respondents only have savings that can last them for less than a month. Although the lockdown was enacted for the society's well-being, it has a great negative impact on those who are economically disadvantaged. The pandemic has highlighted the stark inequalities within society, especially among women and the lower socio-economic status, who often have unstable working conditions and incomes, hence fear of job insecurity or job security and financial uncertainty exacerbate their stress. Therefore, policymakers may introduce long-term legislation to improve social welfare. Living condition is another stressor that contributes to emotional distress among women. Women with low socio-economic status are more likely to live in an overcrowded accommodation with poor housing conditions. The lockdown requires all households to live indoors, restricting access outdoors, thus creating a non-conducive place to stay in. As a consequence, compliance to social distancing is not met. The stress on women is aggravated when the household includes young children and elderly that requires attention and constant care, respectively. The counsellors and other helping professionals may be deployed in a longer term to help psychoeducate the community on activities that can be conducted as a family. Continuous support and provision of information on social media may help in the reduction of psychological distress among women. The emotion stressor relates to emotions that are innately felt, and the nationwide lockdown order has resulted in heightened stress and loneliness among women and vulnerable groups due to social distancing and disruptions of routine work. Loneliness, for example, may be deemed as a worrying problem concerning single women living alone, as reflected in other studies. Despite some detrimental impacts on vulnerable individuals, the lockdown may have helped build resilience among women. This feeling, even when physically isolated, may help to keep feelings of loneliness in check. Perceived support is important to help reduce the feeling of loneliness. Hence, it is vital to recognize women at risk to assist in identifying those who may benefit most from interventions provided by the healthcare providers. The COVID-19 has emotionally affected women working remotely from home. The transformation from working on site to working from home status has created a significant stress in the lives of many women in this study, citing reasons such as lack of motivation, difficulty in juggling work and household, among others. This is also in line with studies that found the accumulation of stress on women were due to factors such as non-conducive environment, handling house chores, dealing with children, managing work remotely using technology, lack of motivations, requires online supervision, job insecurities that affect their psychological well-being. The pandemic may witness lasting changes in the approach of working remotely and structure of organizations. For instance, upskilling in usage of technology and handling work remotely may assist in improving the confidence and clarity of women in what they should do, thereby assisting them to better handle mental distress in this condition. Moreover, women working in the management, professionals, and related occupations may witness a greater shift in working remotely. Therefore, this study proposes for future studies to track the evolving nature of remote work, looking into how the workplace are transformed in the short term and in the long term due to the pandemic. In conclusion, younger women with a lower total household income were identified as the most vulnerable cohort. Hence, relevant authorities should emphasize on specific intervention strategies that may include providing financial assistance, initiating remote jobs, providing mental health support, and healthcare resources. We have also identified several limitations in this study. First, as the data were gathered through online sources, the findings are to be generalized cautiously as women from the marginalized community were not taken into consideration. It is to note that the initial plan of data collection involved face-to-face survey distributions to the disadvantaged women. These include those from rural areas, poor, unstable, or with no internet connection. However, this was aborted considering the nation is still undergoing a restricted movement period which was extended to the end of the year. Nevertheless, future studies could replicate the methodology to include more women from a more diversified background. The respondents in the study were also mostly urbanized, and thus the emotional stresses identified may not fully represent issues deemed more important to women from the rural community or those who are not working, for example. Future studies could explore this avenue as well. These are some of the references used to guide us in our studies, and we would like to take this opportunity to thank all of you for listening to our presentation today. Thank you.